how to prevent stroke during sex, and how to handle it. Stroke during sex is a rare condition, but can occur, especially in people with high risk of cardiovascular or blood pressure. To prevent and handle it effectively, here are the details. 1. Causes of stroke during sex. Sudden increase in blood pressure. Sex increases heart rate and blood pressure, which can put pressure on blood vessels, especially if there is a history of heart disease or weak blood vessels, aneurysm, cerebral vascular malformation. Vigorous activity. Sex can be equivalent to a heavy physical activity, increasing the risk in people who are not used to exercising. Underlying health conditions. Factors such as high blood pressure, atherosclerosis, diabetes, obesity, or heart disease increase the risk of stroke. Other factors. Using stimulants, alcohol, tobacco, drugs, or over-the-counter erectile dysfunction medications can increase the risk. 2. How to prevent stroke during sex. To reduce the risk of stroke, it is necessary to combine a healthy lifestyle and control risk factors. Control underlying health. Regular health checkups. Measure your blood pressure regularly, especially if you have a history of high blood pressure. The ideal blood pressure level is below 120/80 mmHg. Check your blood sugar, cholesterol, and heart health to detect problems early. Manage your medical conditions. If you have heart disease, high blood pressure, or diabetes, take your medications as prescribed by your doctor, e.g. blood pressure medications, statins. Avoid taking erectile dysfunction medications such as Viagra without a prescription, as they can cause a sudden increase in blood pressure. Consult your doctor. If you have a history of stroke, heart disease, or aneurysm, ask your doctor about whether it is safe to have sex. Maintain a healthy lifestyle. Exercise regularly. Do moderate exercises such as walking, yoga, or swimming, 30 minutes a day, 5 days a week, to improve cardiovascular health and physical endurance. Diet. Limit salt, less than 5 grams a day. Foods high in saturated fat, fried foods, animal fat. Increase green vegetables, fruits, fish rich in omega-3, salmon, mackerel, and whole grains. Weight control. Maintain BMI from 18.5 to 24.9. Obesity increases the risk of stroke and heart disease. Avoid stimulants. Limit alcohol, no more than 1-2 drinks per day. Quit smoking, and avoid drugs. Avoid drinking too much coffee or stimulants before sex. Practice safe sex. Avoid overexertion. If you are not used to strenuous physical activity, start with light intensity and gradually increase. Choose the right time. Avoid sex when you are too tired, stressed, or right after a full meal, which can easily cause high blood pressure. Communicate with your partner. Discuss the appropriate pace and position to avoid putting too much pressure on your body. Stop when there are unusual signs. If you feel dizzy, have chest pain, or have difficulty breathing during sex, stop immediately and rest. Recognize the risks. People over 50 years old have a history of stroke or cardiovascular disease should be more careful. If you have symptoms such as severe headache, dizziness, or weakness on one side of the body before sex, see a doctor immediately. 3. How to handle signs of stroke. A stroke is an emergency and requires prompt treatment to minimize brain damage. Signs of stroke, according to the FAST principle, include F. Face, distorted face, crooked mouth when smiling or talking. A. Arm, weakness or paralysis of one arm, unable to lift the arm. S. Speech, difficulty speaking, slurred speech, or inability to speak. T. Time. Time is gold. Call for emergency help immediately. Immediate action. Stop all activities. If having sex, stop immediately and let the patient lie down in a comfortable position with the head slightly raised 30 degrees. Call for emergency help. Clearly state that a stroke is suspected and provide the exact address. Monitor the condition. If the patient is unconscious, check breathing and pulse. If breathing stops, perform CPR if you know how. Do not give food, drink, or medication as this may cause choking. Record the time and symptoms. Record the time the symptoms started to provide information to the doctor, as thrombolytic drugs are only effective in the first 4 to 6 hours, golden window. Remain calm. Reassure the patient. Avoid causing panic. After hospitalization, the patient may be given thrombolytic drugs, if ischemic stroke, or surgery, if hemorrhagic stroke, depending on the condition. After a stroke, rehabilitation and long-term adherence to treatment are needed to prevent recurrence. 4. Additional notes. Post-stroke counseling. If you have had a stroke, ask your doctor when it is safe to resume sexual activity. Usually, after 6 to 8 weeks of stabilization, gentle sex can be safe. Psychological support. A stroke during sex can be traumatic. Discuss with a psychologist or partner to reduce stress. Health education. Learn about stroke through reputable sources or a neurologist to recognize early signs. Thanks for watching the video. Wish you and your family health and happiness.